Your question was, how does prenatal
How
alcohol
does,
exposure affect
yeah,
day-to-day experiences, right? So
yeah,
I think that again, it's unique to everyone, and some people roll with it fairly well,
okay,
but and I feel like, of course, we're always very strength-based, and I feel like people with FASD are some of the hardest working, kindest, compassionate, inclusive, tolerant, um, people who want to do well, people who want to be helpers, people who
okay.
want to make good friends.
Mm-hmm.
And there's also a vulnerability that goes along with that. So sometimes difficulties knowing who's a good friend, who's taking advantage of you. There's often dismaturity that
Okay,
people have trouble getting along with people their own age.
okay.
Oftentimes they'll get along really well with younger kids because they like to
Mm-hmm.
play things longer, and they have more of a kind of a communication style that fits.
Okay,
Or older people, because older people can kind of take care and it's more of a typical situation, right?
right.
um there is real challenges with sensory processing. So
Mm-hmm.
what the little things that we get annoyed with, like a tag in the back of our shirt,
Yeah,
or something like that, can be really overwhelming for people. Like, many
okay.
people I work with don't like to wear jeans, are fussy
Mm-hmm.
about the shoes that they wear, fussy about the textures, fussy about smells, and
Okay.
really, really hypersensitive to things like that. On the other hand, I've met people who can't smell anything, and
Okay.
can't taste anything. And that's a hard
Mm-hmm.
neurological sign. So you'd
Mm-hmm.
never be able to smell a beautiful cinnamon bun, or, a loaf of bread that's coming out of the oven. Um, Lots of times people with FASD struggle to see other people's perspective, because that's an abstract concept, right? Like, how does somebody else think about something can be
Right.
really difficult. That doesn't mean they don't care what other people think. It means that it's not available to them. So there again, we might think they're not empathetic
Mm-hmm.
or not compassionate people, but actually they're all of that, and
Mm-hmm.
they have difficulty seeing other people's perspective. Um, Rigid, very concrete thinkers. So,
Okay.
this is the rule. So, for example, yeah, they can find when other people can break a rule very, very
Uh-huh.
easily, but for
Okay.
themselves, they might see a rule changing a little bit for them,
Mm-hmm.
because their definition of stealing, for example, they know not to steal, but if a phone is just sitting on the counter, does that really belong to anybody, or is that mine now to take? Right? So,
Okay.
that would be, and that happens a lot, right? And then
Right.
two, okay, I'm turning 18 now. I'm an adult, even though I barely got through high school without a lot of support. Now all of a sudden I'm going to go to college because I'm everybody else going to college, and I'm old enough to go to college. I can do it. And
Right.
so that inability to look ahead and see
Mm-hmm.
what possible consequences are going to come
Mm-hmm.
from mistakes is really, really hard. Uh,
Okay.
and it's not because they don't know not to steal. It's not because they don't know not to punch. It's because in the moment they're impulsive. So I think the impulsivity and the blurting things out,
Mm-hmm.
uh, being very, very sensitive to things, and really being able to, at times, read the room, but really feel the energy, is something that's both a strength and because sometimes we give off messages that we don't really want other people to know, and
Right.
or it's not directed at them, but they might interpret it and then
Right.
trauma and conflict is harder to reconcile for people.
Okay.
Memory is a big one though, and confabulation. So confabulation happens when people pull together a
Mhm.
bunch of different memories or circumstances and then create a new sort of set of circumstances or truth, right?
Okay.
And
Uh-huh.
the context can be very different, but hard for people to challenge their own memory. Like, so, we might not remember things exactly the same way, but if you and I kind of talk about it, we'll go, oh yeah, that's right, that's right. And
Right.
oh, I made a mistake. Whereas if people are locked in their memory, no, this
Mhm.
might happen. It's difficult.
Okay.
So yeah,
Okay.
those are some of the things that happen on a day to day.
Day to day. In terms of education, what are some of the challenges? I do realize that the memory is impacted the way they comprehend. That might be a problem as well. But what are other things that might be a challenge in terms of the education?
Well, what's a challenge is that usually their IQ is normal or typical or
Hmm.
but within the domains that are tested, for example, like there might be a huge discrepancy between you know, long-term and short-term memory. I'll just make it simple. But even
Okay.
within the way you comprehend and reason, there might be huge
Hmm.
discrepancies in there. Like I know people who have a really lousy memory, but they can be a human GPS, right? So
Okay.
really good at knowing where to go, way better than me, but you
Okay.
can't remember things properly from, how to do a math problem, right?
Okay.
So there's lots of subtle and sometimes more significant learning disabilities. It doesn't mean that they
Hmm.
can't learn. It means they learn very differently in some cases. But it's very
Okay.
much a scattered profile because again, the alcohol doesn't hit the same place for everybody at the same
Right.
time,
Yeah.
and uh, and people develop at different levels. So yeah, I mean, it's learning the concentration, the impulse, the social problems are probably the most impactful, I think.
Okay.
And then they become, anxiety is a primary symptom of FASD too, but you can become a lot more anxious when school is not a safe place. And you
Okay.
can become a lot more, you can have a lot more depressive symptoms when you have no friends. And
Right.
when you try so hard to be kind and nice, but you keep ticking people off on a regular basis, or you keep getting overwhelmed. And then most of the time, people with FASD are very good to like live in the moment, right? So like
Okay.
but that's also like an impulsivity. I'm doing it now, I can't think about the future. But then also that means that if you and I have a big row today
Hmm.
and I've hurt your feelings, well, tomorrow you're still going to remember that and you're going to be like, Angela is
Yeah.
not somebody that I can trust. Whereas for me, if I have FASD and I have a row, I may not even remember what we fought about, but B, that
Okay.
was yesterday. Like I'm here today and I'm ready to be a good friend today. So don't hold
Okay.
that against me. But
Okay.
people don't act like that, right? People
Right.
don't interact like that. I mean, more of us should, right? To get past things and to live
Yeah.
in the moment a little bit better. But we
Yeah.
kind of hang on to things and our memory serves us well in terms of keeping us safe and helps us to learn. So
Yeah.
that's not always available for people who have been impacted.
In fact, right. And
Mhm.
what are some of the challenges that the family or the caregivers might be facing?
And I think most of the time it's like typical parenting strategies don't work.
Hmm.
Uh, so we have to spend more time protecting the environment, making adjustments to the environment, um, being very, very supportive and I don't know, intrinsically looking for what might be going on behind the
Right.
outbursts or the frustration or the discomfort. Um, but usually we consequence people who misbehave, and consequences don't work in the same way for people who are in the moment, who are impulsive, and who really don't want to be.
Right.
right? So I feel like, there needs to be a bit of an acceptance on behalf
Mm-hmm.
of the individual affected. Uh, with individuals is like, okay, Houston, we do have a problem. Um, and your perspective and your memory and your understanding, all these things may not be 100%. So we have to accept that. And then we have to find people that we trust that can be supportive. But lots of times this leads to combativeness. Like if you and your mom always remembered things differently, you wouldn't trust each other.
Yeah. Yeah.
You wouldn't trust your mom. And
Right.
that creates a lot of trauma. And it also creates a lot of trauma for the parents and caregivers who are trying their best, but are often misunderstood and not and judged, like judged so harshly because their kid's the one that's running off the soccer field or having a fit,
Yeah.
and or having a meltdown in the grocery store. And we all know how we look at kids who melt down in the grocery store, right? So the
Yeah.
parents are often feeling very inadequate and very misunderstood and not supported and dismissed continuously by their doctors, by their teachers, or by their kids' teachers, and that kind of thing. So that's why I wrote another book called "Not Your Typical Parenting Guide."
Okay.
And the other book that I wrote is oh my gosh, what's it called? Your Complicated and Beautiful Brain, right? So
Okay.
that book really kind of describes what the effects of prenatal alcohol exposure can look like across the lifespan. So it gives you that, more in-depth understanding of what we've been talking about today. And the parenting guide goes through, things that all kids will benefit from, and then specifically some of those domains like memory, sensory processing, executive functioning, planning and organizing, sensitivity, processing of information, um, all of those symptoms and what that might look like in the day to
Mhm.
day, and how we can be supportive
Okay.
in a different way. Mm-hmm.
Okay. So, I have always believed in this that the dynamics of the parents and the children with the neurodivergent disorders matters for their progress or how their life experiences will be. Well, it can be a lot stressful for the parents, and I do want to understand, like, other than the support groups, what more can we do for these parents to actually, feel supported and to
Mm-hmm.
just have a better dynamic with their kids?
Well, I think one of the things that we have to realize is that sometimes there's nothing that you can do to change the dynamic. And I don't
Mhm.
want to say that in an unhopeful way. Like I think in most
Okay.
cases we can always do something to polish something up or to make people feel better. But sometimes the behavior is random and
Mm-hmm.
it's a symptom. It's not a behavior. It's not because anybody did anything wrong. It's
Mm-hmm.
not because anybody missed something. It's because there's a whole bunch of stuff going on in that body and things just come out. So,
Okay.
but when you are living, and we've all heard, walking on eggshells, or you're not able to go to Christmas dinners anymore with your family because there's explosions all the time, none of the cousins get along, he doesn't get along at school, he's kicked out at school all the time. Of course there's going to be mental health concerns and mental wellness concerns for all family members that need to be supported.
Right.
So my suggestion, is, create a circle of support.
Mm-hmm.
We as providers need to listen to parents, and we
Mm-hmm.
need to realize that we are not the experts. They are the experts of their own children.
Mm-hmm.
Also, though, they're the experts of their own children. And sometimes when we're in the middle of a chaos or crisis or a long-term situation, we don't see clearly. So even though we think we've tried everything, we may not have, right?
Right.
We also have to, as providers, like I am acutely aware that whenever I make a suggestion, the parent might go, "Are you kidding me? Like, do you think I didn't try that?" Right? Like,
Right.
so we have to be really mindful of the fact that most of the time, the people that we're supporting who are coming to us for help are really
Okay.
good. But typical parenting strategies do not work in the
Not
same way. And that's why we have to create different opportunities. So instead of expecting a child to learn how to be more efficient in the morning and follow directions and get to school better, no. We have to be creative, and we have to make sure that their clothes are all ready every day of the week. We have to make sure their backpack is packed already and maybe put in the car. We don't ask them to do it anymore. Maybe I know one mom that, she fluffed her son's clothes in the dryer every morning to help him get dressed because it feels really good. Like just a whole bunch of really weird and odd and lovely and creative ways to get to the same place. Right.
okay.
But doing the same thing again and again, expecting a different result, gets us into trouble.
Okay. Thank you so much for the insight, Angela. And from now on, Nadine will be having some of the questions that will be regarding the diagnosis and the prevention and awareness, and then the resources.
Hi, I'm Nitin.
Hi, Nitin.
Okay, can you describe how FASD affects mental health and what kind of support are important in this area?
Well, I think that I've never met anybody with FASD that doesn't also experience symptoms of anxiety, symptoms of depression, personality, complexities. So I think that they're very much, intertwined. Unfortunately, I feel like most of, well, not most, but most of our mental health services do not consider prenatal alcohol exposure, or the fact that a significant number of people who are accessing mental health supports also have been affected by prenatal alcohol exposure. So I think that's the biggest one. They do coexist, but you can't support people in the same way because there's memory problems. There's the opportunity of misunderstanding or not being able to transfer the learning from one situation to another. So again, I do training for therapists. It's 10 hours of intensive training to help people to better identify, better screen, and better assess and better support, because we have to do it different.
Okay. Are there any specific therapies or approaches that work best for individuals with FASD?
I use acceptance commitment therapy a lot. And the reason why I find it really quite effective. I mean, that doesn't mean that people all of a sudden are fixed or changed, or people, this is brain interference, right? So it's not going away. But as I mentioned earlier, a lot of what we're seeing are symptoms and not behavior, not willful defiance, not mistakes that are just negligent. So for me, what I love about acceptance commitment therapy is that it really helps people to reconnect with their values and who they are as people, which is often very different than the way their behavior plays out. And people judge, we all judge ourselves and each other on the way we behave. So if I steal something, I know that I did something wrong. I am a thief. There's no, that's how I would define myself. But if I take something impulsively and put it in my backpack and not realize until later that I took it, I'm going to feel like I'm a thief, but I'm not going to know why I did. Like, I'm going to feel terrible, right? So what we have to do is, what I love about acceptance commitment therapy is that, okay, no, this is your character. This is who you are. These are the things that you value. And these are the symptoms that get in the way of you living in line with your values. So how can we work together to collaboratively mitigate risk and cope? And I just feel like I see weights lift off people's shoulders when I'm able to separate them from their behavior. So that's a big one. And it works for, it's helpful for parents and caregivers. And it's also really helpful for kids of all ages. And there's a little kid in all of us. So, yeah.
What role do cultural factors and Indigenous community play in FASD prevention and care?
I think cultural implications are relevant no matter what globally, right? With our Indigenous population, I think there's a misconception that FASD is an Indigenous condition, which it's not. It was initially, some of the research was originated within our Indigenous communities, which kind of set that tone. But I'm here to say that Indigenous people are less likely to consume alcohol during pregnancy than many other cultures, and certainly less likely than Caucasian Canadians. However, it's my experience and practice-based experience and evidence will tell you that when there is alcohol consumption, there's often alcohol consumption as a result of intergenerational trauma and mental health, and it's medicine, right? Like it's used to help with the symptoms of trauma and that kind of thing, and intergenerational FASD. So it is that's again multicultural, but I have seen situations again with Caucasian families as well. I mean, I had somebody in my house doing some work, and within 10 minutes, we found 11 people in her circle that had been impacted by alcohol. She was, working professional. Her husband was a working professional. Her ex-husband was a working professional. Like, there's just tons, right? So it definitely happens. And there was an example of where I worked on one of our local reservations, and I did a home visit. I was assessing a little 18-month-old, and when I was there, the little guy was being raised by his great-grandmother. So the great-grandmother was then asking me, what's the difference between FASD and ADHD? Because my oldest boy, oh boy, he really had a lot of trouble. And when he was a baby, he just used to rage and pull on the crib handle, the crib, whatever. And just really was dysregulated a lot of the time, spent a lot of time in and out of jail, just never seemed to pull through, and get well. And so then I asked her, I said, what would be the chances of the pregnancy being exposed to alcohol? And after I gave a little bit of a rundown of some of the differences between FASD and ADHD, and she said, oh, absolutely. She said, we all drank until we, kind of passed out back then. That's what we did. And again, direct descendants of people who were part of the residential school system and part of the 60s scoop. So there's trauma and lots of it. And there was significant amount of alcohol in that case. And then unfortunately, she had 5 children, all of whom were impacted. And then they all had 4 or 5 children, all of whom were impacted. And now we have the 4th generation who are impacted. So that happens again, multicultural, but I think, and I know that our Indigenous culture is incredibly resilient and amazing and inclusive and community minded and collaborative. And, to me, there's so much strength and wisdom. And there's also intergenerational trauma and also intergenerational FASD. And they can't be supported in the same way. People recover from trauma easier than if you've been also impacted by alcohol exposure. So I hope that makes sense, but that's my...
Thank you, Angela, for sharing this.
Hi, Angela.
Hi.
I know you're too exhausted now, but this is the last question from us.
No, that's okay. I can talk about this for a week. Yeah.
I know you can.
Yeah. Yeah.
So I would like to know that what are the resources for those children and their parents in the London-Middlesex area?
Well, provincially now we have fetal alcohol spectrum disorder coordinators. So I think that's where we would go first of all. There is a website right now that's the funding, it looks like it's being taken away from the Ontario government's perspective, which is really disappointing. But we do have an FASD Ontario bilingual website where you can go and look for FASD workers and FASD support groups, because our province also offers micro grants to communities to offer FASD support groups. And you don't have to have a diagnosis in order to access those services, which is very critical. But those workers, I think, would be your first point of access. And they're, the Children's Coordinated Services Network is where our ones in London are. So you can call them directly. But if you Google FASD coordinator in London, you should find one, which is good. The London Family Court Clinic does assessments, and Navigation Onward does assessments. As far as individual therapy, I have to say our children's mental health agencies do not have FASD informed clinicians typically. I'm not saying there aren't any, but I don't know of any, and I know that we've been trying to work with them here to build that capacity, and we've got new staff coming in all the time, and I mean, it's not something that's taught a lot in all of the post-secondary education, right? We're lucky that Fanshawe has this in the child and youth worker program. It's not in every child and youth worker program, right? So we don't have a lot. There's not a lot of clinicians like myself that do this work, but I am available. So in the London, and in the province of Ontario. So,
And add on to that, just could you please tell me about the support services for parents and caregivers as well as?
Well, the support services that I know of are the support groups, right? So, and then Interwoven Connections also is formally Adopt for Life. So they have some peer support workers and staff members that are really, like, I would have said 7 years ago, they were not FASD informed. Now I think they are becoming more and more, but they are looking at doing some more training with me. So I think definitely they're interested and more aware. And yeah, like I would do the support groups, and I do parent education and support all the time. And like I said, there's not many in Ontario that do, but what did I just say? It was formerly Adopt for Life. Interwoven Connections has a couple of therapists there, Tanya Eckler and Maude Champagne, that are amazing. So they're their clinical directors there, so they would be helpful.
Okay, Angela. That's a lot of information for us to know about the FASD, and we are so grateful for you to be here with us.
Yeah.
And also we have learned a lot about FASD, like beyond the articles that we read. So thank you very much for having us.
So there's one more thing that I wanted to say too. I think you probably know this, but FASD is more prevalent than autism, cerebral palsy, Tourette syndrome, and Down syndrome combined. And the most recent research indicates that in North America, it's 8%. 8%. That's almost 10, and it probably is because we know they're low estimates. We know that people do not always participate in studies. So I think that's such a critical piece of information that we need to know. And in Canada, over 80% of people consume alcohol, and over 50-60% of pregnancies are unplanned. So we can do better in terms of prevention. And I'm starting to, get little posters out, little cups that say alcohol free for baby and me, and, little inserts and pregnancy preparation packages. I think we need to start talking early.
Yeah, exactly.
Those early weeks matter. Yeah.
Yeah.
Okay.
Yeah, you're right. Prevention is better than cure.
Yeah, for sure. We can do better for sure. So
thank you so much. It's been an honor to have this conversation with you today.
Okay. Thank you.
Thank you so much.
Take care, guys.
Yeah, you too.